Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 468,862 confirmed cases of COVID-19 in Canada and 142,121 cases in Ontario. Chatham-Kent has 552 cases, and Sarnia-Lambton has reported 452 cases. Michigan now has 437,985 cases, with 23,408 cases being in Detroit. Today we are reporting 136 new cases of COVID-19 in Windsor and Essex County. 35 of these cases are related to outbreaks. 2 are contacts of confirmed cases, 4 are community acquired, and the remainder are still under investigation. We have had 4,899 cases since March. 3,971 cases are now resolved, and 837 cases are active and being followed by our health unit. 53 confirmed cases are currently in the hospital, and 10 people are in ICU. In Windsor, there are also 67 suspect cases of COVID-19 in the hospital. Our community has lost 91 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 24 active outbreaks in Windsor and Essex County. 7 in long-term care and retirement homes, 11 in workplaces, 3 are community outbreaks, 1 in the hospital, and 2 school outbreaks. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit your close contacts to your household members, the people you live with. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors, outdoors if physical distancing cannot be maintained or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID-19 Exposure Alert app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centres. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 3 testing and assessment centres: Windsor Regional Hospital OLEC Campus, Windsor Regional Hospital Met Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. Please note that there are delays at this time due to the volume of cases and data entry of these cases. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As Teresa mentioned, that with the rising number of cases, there are some delays and challenges with us reaching out to all the cases and their contact. As of 2 p.m. yesterday, we had 528 positive cases that were awaiting some outreach by our health unit, and we will be making some significant changes to address those issues to reach out to our people as quickly as possible. While many of these individuals are contacted by an initial triage people to provide them with the results and provide them with the instruction to self-isolate immediately, identify all their contacts. In addition, we may change our process to ask these cases to call their contacts directly immediately, and public health may or may not circle back with these contacts in the long term. We will be prioritizing our cases based on the relative risk of each of these individuals, and the new ones more specifically to allow better containment methods rather than going back to cases that were positive a few days ago and are already on the verge of completing their isolation. All of the high-risk cases from long-term care home, retirement homes, schools, cases that are linked to other outbreaks will continue to be prioritized for containment. You will hear more on these updates in the next couple of days. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. I had noticed on the website that several of the pie charts that had been there are not there today. There's only one, actually. So are you having a hard time keeping up with data management with so many new cases?
Taylor, yes, with the data that we are getting right now, obviously it requires some investigation to assess their exposure source, assess their linkages with whether they belong to any specific sector or not. So in short of giving the community wrong data or dated information, we have temporarily pulled out that information to make sure that when we have all the right information, we will continue to populate it. We are doing our daily briefings just to fill some of those gaps, and we will continue to share the full epi summary on every Friday. There are definitely some delays, and that's why we pulled those pie charts out of our website.
And you mentioned that you may be asking people to reach out to their own close contacts. Has that begun yet? Of course, having a layman do that might pose more risk. You're putting a lot of trust in individuals. Can you comment more on that?
So the challenge is, Taylor, what if we are delayed or if we're behind those cases for a long period of time? So let's say if today someone is starting to show their symptoms, and we know that there are delays in them getting to the assessment center. It may take 2 days to book an appointment and go to the assessment center. So let's say if I'm showing my symptoms today, and then I go to the assessment center 2 days from now, and then it will take another couple of days before we get the positive result, at least if let's say a couple of days, 3 days, 2 to 3 days. It's already 5 days since the onset of symptom. And then because of the delays in us getting to these individuals, let's say it take us 48 hours to get to them. It's already 7 days since the onset of symptoms. So by 10 days, they will no longer be considered infectious anyways. So we are getting behind many of these cases, and it would not do good to anyone if we are connecting them with them on day 8 or day 9. So we want to make sure that anyone who is symptomatic at this time with the high positivity rate in our community, the likelihood of them being positive for COVID is very high. So anyone who is showing symptoms, I think they should start isolation immediately, and along with their family members, because they will all be close contact of them. They should also isolate immediately. The moment you get your test results back, I think that would be a good time to expand that isolation request not only to their close family members, but anyone else who were in close contact with those individuals. And if we go back to our public health messaging, those number of close contacts should be no one outside their family members. So in theory, we will still be in a better containment phase. The challenge is for those individuals if they have many contacts outside of their close family members. So at this time, I think if we're really trying to work on the containment strategy, we would like to focus more on catching these cases as soon as possible rather than trying to trace back many cases that were delayed. And if you're always talking to those delayed cases, it will have some challenges for the immediate run. So we will be looking at those processes. It does require some process changes, but not to say that we will not be connecting with them, but we will still need to connect some basic data to help us for provincial reporting purposes, for our case and containment purposes. But the priority would be more on the more recent ones, just because of those delays, and we possibly cannot go and interview all of those 528 cases in a timely manner. Each interview, as we mentioned, it takes at least 1 to 2 hours per case, and that's time intensive. So we'll try to reduce that timeline to do as many case and contact follow-ups as possible with all the support that we have from the province and with the additional staffing.
Okay, thank you.
Any questions from AM 800?
Yes, Dr. Ahmed or Teresa, going off Taylor's question about the website, just under the current outbreaks at long-term care or retirement homes, how are those numbers updated daily? Like, how accurate is that? Because, for example, the village of St. Clair, according to the website, last updated December 8th, 4 residents, 1 staff member, but the union is reporting there is up to 53 residents that have the virus or tested positive for the virus. So I understand, and I know your team is working around the clock, and the website now doesn't get updated all the time, maybe. But I'm just wondering if a resident of the community is looking at the website, what should they be looking for or looking at if they're concerned about some of these outbreaks?
So I can comment on the website piece of it. And so you're right, there are not 5 cases, there are many more than that. I think our count is closer to 73. However, we still are investigating 11 of those cases. So as Dr. Ahmed said, the information is coming in very quickly, and we are trying to work with the homes and give them the support they need. So the website will be updated, and your question about is it done daily? Normally it is done daily, but it's this getting the correct information to populate the site and make sure that the cases that we're attaching to this outbreak are indeed part of the outbreak. So I believe there are 11 outstanding cases that we're still trying to attribute to a facility, whether they're staff or residents. So as that information becomes more available, we'll update our website. So we are working on it. I'm looking at Mike Janice across the table, and he said they are working on getting everything updated today, but we are trying to be as accurate as possible, recognizing that it's not accurate now, it's outdated.
And if I
I was just asking for a resident because obviously I know, and we all know that we call in every day. We know you guys are working around the clock. So I just wanted to see, I guess, if someone doesn't listen to this on a daily basis and they go to the website, just if they would be lost, I guess, saying, how come this doesn't add up to what the numbers are really showing?
So I can add 2 points to that, Rob. Completely understand the concerns. So one thing that when what you're reporting is not the date when it was last updated. It was the date it was first reported. So there's a difference. So even when you can say some of the homes were reported on 30th of November, that doesn't mean that they were not updated immediately. So we try our best to update that. The challenge is number of reasons because of the delays in how we are getting the information from the residents, from the facility itself, and then the confirmation from our staffing. Generally, for many of these outbreaks, it has never been our practice to report the exact count of all these residents and staff because it can change. But for COVID, we are trying our best to provide that information. The number added up very quickly, so that's why you're not seeing that. So as Teresa mentioned, that we are looking at ways to update in a timely manner. So I can completely understand the challenges, and we will look into it to provide the most up-to-date count as soon as possible. But recognizing again, it will be an ongoing struggle for us to provide the complete breakdown of residents versus staff versus the total cases. So we just wanted to make sure that we put it out there that there may be some differences in terms of what we are reporting versus the actual case counts.
Also,
For the village at St. Clair, with the numbers skyrocketing there, I guess we had the union on this morning, and Tulio DePonte talked about how it's obviously impacting staff, and he's worried if more staff members are positive, how they will take care of the residents. I'm guessing that's always in the back of your mind too, Dr. Ahmed, just with the rising numbers, how will this all be taken care of?
So I'll start, and then I think Teresa wants to add as well. So obviously when we declare an outbreak, it automatically triggers a process to assemble an outbreak team. And our outbreak team consists of public health staff, the facility director of care, the infection prevention and control person at the facility, the affiliated hospitals. So each of these long-term care home and retirement home have an affiliated hospital. It's either of the three hospitals, Windsor Regional, Hotel Du, or Erie Shores. So we have a representative from that hospital, and also on top of that, we have a representative from Ontario Health, Home and Community Care. And with the group, obviously, we have our own distinct roles and responsibilities. So we manage the outbreak and we provide our recommendations strictly for the purpose of managing the outbreak. We do recognize that in managing these outbreaks, the biggest challenge is the staffing and the cohorting piece. So we provide our recommendations from a staffing and forwarding perspective, and then also we provide more guidance on who can work and who cannot work. So we work with that facility. But in terms of the actual staffing shortages, the agencies that are mainly responsible is obviously the home first. But then on top of that, the Ontario Health and these affiliated hospitals, they provide the healthcare staff to support the facility. And right now, with the large number of outbreaks, there are some pressures overall in the system because our hospitals are in outbreak. We also have many facilities that are in outbreak. So the partners are trying to provide that relevant support, but it is a top priority in our mind from the facility perspective. And our team is on top of that, and we will continue to find ways to support the facility in best way possible. But I just wanted to make sure that we understand the role again from a public health perspective, and we have been in contact with all our partners to provide that staffing support that they need.
And just to add, Rob, I like your idea or your, bringing to our attention the fact that people, not everyone's listening. So I think we're going to put a disclaimer on the website page. So alerting people that it may not be accurate until we can assure that it's accurate at all times. So I do think that might be one way to address the website issue right now. But anyhow, just wanted to say that. So thank you.
Thank you.
And Rob, we just updated the webpage, so if you hit refresh, the numbers have been added. Any questions for
I
today?
just want to say I appreciate that. Like I said, Mike, I know you and your team are working around the clock, but just like I mentioned, not everyone listens to or watches it on YouTube. They might go to the website, so I just wanted to ask.
Okay, thank you, Rob. Any questions from CTV?
Yes, good morning. With all the protocols in place at long-term care homes, how discouraging is it to see the virus sweeping through that sector again?
Well, I think it is concerning because there are a number of protective layers have been added to protect these facilities, and despite all of that, the virus somehow still make it through to reach out to the staff or to the residents. And with this widespread transmission within the facility, it does poses some risk to the residents. And we will be working with the facility to identify all of those issues and try best to address those concerns in the short one immediately, as well as trying to propose some recommendations for the long-term impact perspective.
Okay, thank you. And this question is from my colleague, Bob Belichico, who wants me to ask if you can explain to the fitness gym owners to help them understand why they can't allow people to exercise while transmission rates are low across Canada in their sector.
Hi, Bob. I think I would redirect that question to the province because those are these regulations and these restrictions are coming from the province, and those are not local recommendations. However, we do know that, and I've mentioned this before, some of these places where whenever you have congregation of people, there is a risk. Having said that, this is not a local recommendation, and any concerns on that should be communicated directly to the province.
Okay, thank you.
Any questions from CBC?
Yes, good morning. Going off of question about the village at St. Clair, and you had mentioned, Dr. Ahmed, with the surging case numbers, again, triple-digit numbers today, it's creating a difficulty for you guys to track all those cases and get those contacts out. But has the health team been able to look into a possible origin or cause, or investigating a possible origin or cause? We spoke with officials with the union last night, and they have their theories, but I just wanted to put forward that question to you guys as well.
So I think at this time it would be premature to even say who the index case was or how it started. Generally, in most of these facilities, the index case is typically a staff person, and then it starts to spread. And again, I'm not trying to blame any staff person here. It's just the nature of the how these transmission are happening in the facility. So at this time, I don't want to say anything prematurely in terms of how it's introduced and how it's spread. The investigation or the outbreak investigation is ongoing, and anytime when we are dealing with the outbreak, the immediate concern is how do we protect everyone else, and what kind of control measures we need to put in a short-term basis. And then we continue on with our hypothesis generation, that how it's spread and what are some of the measures that we need to put forward in the long run. So those are ongoing discussion. At this time, I cannot comment on anything specific to how it spread.
And Dr. Ahmed, again, you're mentioning there, we can't talk specifics there, but in terms of the sector, as a whole, when you see cases surging in a home like this, I guess my question would be, what is going wrong at the forefront? Again, we're not talking about this specific home, but this is a sector that has seen outbreaks, time and time again. So can you speak to sort of from past cases? I know you mentioned a staff member that's picking it up and bringing it into the home there, but is it a case where you can say, okay, something's going wrong? Somebody's not doing what they're supposed to be doing, or is it kind of just the nature of the beast where, it is what it is at this point? Well, what's your take on that?
So the first, part is critical in terms of how it's spreading, and the easiest part is that I think we all know to explain is the indoor close proximity, the building, the facility. It helps to spread the disease very quickly. So any kind of high risk setting that is indoor, it spreads like wildfire. So I think that everybody knows that. The challenge is then, what can we do to protect it from getting introduced into the facility, and what are some of these secondary measures that we can put in place to protect the vulnerables in the community? What we are noticing throughout this pandemic, and again, don't want to shift blame on any individual or any particular group or anyone at all, but the challenge always is either an inappropriate use of personal protective equipment, or the personal protective equipment not used at all. So those are two of the major concerns that we identify in many of these settings. And even a simple lapse of these process, it can lead to a spread. And then with the residents, and if the residents and all these activities already happening, when residents are connecting with each other, there is this possibility that can go very quickly from one resident to another, or if it's a staff person who is sick and either not following all those precautions, they can move or they can spread the disease from one person to another to another. So those are some of the typical mechanisms that we have seen, and that's why it's important that we focus more on these homes when they're not in outbreak. So we have put out many recommendations for these facilities, and we continue to connect with them every week. Even when they're not an outbreak, our team of inspectors connect with them, check on them. Hey, what's going on? Tell us about your staffing issues. Everything is okay. Do you need any other guidance? Do you need any IPAC supports? So we do talk about that. We talk about the auditing, that if there is any process of auditing these staff, that are they wearing the PPEs correctly? Because if they are sick and if they are wearing it incorrectly, they can spread it. But even when they are not in outbreak, what is the auditing practices looks like? And if there's any room for improvement at that time. There are a number of issues that are linked to just the, I guess, inappropriate use of PPE that we try to address, but obviously the facility on site, they have to enforce that. They have to monitor all of their practices and continue to review it again and again. So this is a difficult time, and we know that once it starts to spread, it spreads like wildfire. So I think there's no doubt about that, that we have to do our work backwards and prevent any new cases from getting introduced into the facility. So unfortunately, it already has spread in that facility, and now our goal is containment and to make sure that everyone, we can protect as many people as possible from contracting the virus.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. Can you hear me okay?
Yep.
Okay, good. Just going back to the case and contact tracing and the priority that you'll be placing, so you said the priority will be on members who are linked to outbreaks. Can you explain why the priority is there? I mean, you already know where the transmission happened, right? So just explain why that is important to have that priority there, and that's why that would be your focus.
So the key priority, obviously, we know the people who will suffer the most is the people with the chronic underlying medical conditions and people who are elderly and seniors. So long-term care home and retirement home will always be our priority. It doesn't matter what we are dealing with. What we are talking about, the outbreak related cases, is the potential and the potential exposures, because many of these, like if there's any super spreader event type happening, either in a form of an outbreak or in any other settings, we can stay on top of it. The cases, let's say, if they are in the community, if they don't have any exposure to a high-risk facility. So for example, if I am someone who doesn't go anywhere and then just go to work and then come back home and don't do anything, there will probably be, the risk place would be, home will automatically be high risk, so they will all be there. Then the workplace could be whether they interact with anyone or they work with anyone in a setting, or whether they just work on their own or work from home. So we'll have to make those distinctions. But let's say if someone who works, but they work in a high risk setting, such as a long-term care home, retirement home, or a childcare setting, then that would automatically make it a high-risk individual that requires some further discussion to assess the risk to anyone else who come in contact with that individual. So we'll have to look into that, and all of those processes we are currently working on, and you will hear more. But generally speaking, the outbreak potential, because it can easily increase the number quite significantly. So that's why we focus more on the outbreak pieces, and not to say that we will never talk to those who are not high risk, but I'm just saying about the priority perspective in terms of how detailed assessment investigation that we need to do. We'll be focusing more on those high risk individuals.
And so I guess it becomes even more important for everyone to keep the contact of who they're coming in contact with, where they're going, so they can make those phone calls on their own.
Yeah, and that's exactly some of the reasons that we have been, we shared our messaging, we shared our media statement about a week ago, highlighting the importance of keeping and maintaining a diary of who you are meeting with, who you are interacting with, because that would really help you and help everyone else to stay safe. The bottom line is, because of the restrictions, and even on top of that, our recommendations, which has been there for quite some time, is try to minimize your number of close contact. So everyone, if we just stay close to our own family members, none of us will have a high risk close contacts, and then the work will be cut out for you as well as for us. So it is important that we remember that, and it would serve both purposes. Obviously, it will limit the spread of the disease more widespread, and from a system perspective, it will really be helpful to track everyone who is impacted by it.
Thank you.
Any further questions from the Windsor Star?
Yes, I noticed there are 2 more outbreaks declared at farms in the county. Can you give us a sense of how bad those outbreaks might be? How many cases that we're seeing today, yesterday, might be attributed to those farms? While I understand you might not have the exact numbers in front of you.
Yeah, so you're right, Taylor. We're still investigating some of these cases. All I can say is at least one of the farm, there are a number of cases. The other farm, they don't have that many cases, but again, it can just be a start at this time, and it can spread further. And all those high-risk close contacts, obviously they require self-isolation, which we are working on it. But overall, it's still evolving, and and that number will change. So maybe I cannot give you like a final number what we are dealing with, but definitely the farm cases are evolving at this time.
Okay, thank you.
Any further questions from AM 800?
Teresa, when it comes to the schools, I noticed Villanova in LaSalle has 3 cases. If students were in the classroom right now, would Villanova be considered an outbreak?
So the cases are not necessarily meeting the requirement of an outbreak. We'd have to look at the exact cases, but they would have been, based on our discussions, it would be dismissing the cohort. So we're treating it as if they remain in school, even though they're all doing online learning, and informing the school that these cohorts are would normally be dismissed. So, but not necessarily an outbreak. They are just cases that were linked to that school. So we continue to follow up on if they were in school during that time, and if their cohorts are impacted. We're still sending it out as we normally did prior to going online this week.
Okay, thank you. And finally, Dr. Ahmed, we had a call yesterday, and I know you touched on this earlier in the summer, but the province yesterday announced that Windsor had 114 cases. Windsor-Essex had 114 cases, while the local health unit announced 195 cases. Can you talk about, I know you mentioned in the summer, but why is there a difference between the provincial numbers and what they're reporting and what the health unit reports?
Rob, it really depends on when the data is pulled from the system, and the province, they pull their data at 4:30 p.m. Typically every day, or the day before. So for example, whatever they're reporting, it would be from yesterday data that was pulled at 4:30 p.m. We are pulling our data early in the morning to provide you with the most up-to-date information, and that's why you can see that that number. But once it's all said and done, if you go back to our epi curve that's reported on the website, that is tied to the exact reporting date. And then when you look at that, it will all add up completely. So it's just a reporting delay. So sometimes we report early than the province, and that's why you can see the difference.
Thank you. Have a good day.
Any further questions from CTV?
No, thank you.
Any further questions from CBC?
Yes, this past Friday, the health unit had said it was investigating a cluster of 4 COVID-19 cases at Windsor Regional Hospital's Met campus. Just looking to get an update on that investigation.
So we have received additional staff cases, 2 additional staff that are tied to that same cluster. So far, there's still no evidence of transmission from staff to patients or any patient that are involved in this cluster. So we are working closely with the hospital to make sure that everything is managed appropriately and without putting any resident or anyone who's hospitalized at risk at this time.
Okay, thank you.
And any further questions from Blackburn?
No, thank you.
Thank you, everyone.